I'm just still waiting to hear back on what they have planned for us.
I want to be with my students, but I don't want to affect my family.
Part of my job is also keeping my students safe, and I'm not going to be able to do that this next year. It's just, I can't.
Palpable concern there from some of our nation's teachers as the school year looms. The Trump administration is pushing all schools to resume in-classroom teaching in a matter of weeks. But the nation's top infectious disease doctor isn't so enthusiastic. Here was Dr. Fauci earlier tonight.
I think you have to start off by saying what is the default position that you would like to hold. And that is we should try as best as possible to open the schools. However, and I underline however, having said that, what is paramount is the safety and the welfare of the children and of their teachers. And so we live in a big country that has a lot of diversity with regard to the level of infection in a particular community. And the people responsible need to take that into effect.
The answer was in the nuance right there. The federal government hasn't offered any guidance on how to safely bring kids back into the classroom or how to pay for additional safety measures. Our next guest calls it nothing short of moral bankruptcy. And with us once again for more, Laurie Garrett. As a science writer, she is the recipient of the Pulitzer Prize, the Polk and Peabody Award. She is the author of The Coming Plague and Ebola, Story of an Outbreak. Also happens to be contributor to Foreign Policy and a former senior fellow for global health at the Council on Foreign Relations. Laurie, it's so great to have you back on the broadcast. We look forward to your visits, even though we would give anything to change the subject matter. What an intensely personal decision for teachers to teach, for parents whether or not to send kids back. What, in your view, needs to happen before we reopen schools?
Well, Brian, first of all, we shouldn't even be thinking about reopening schools in communities where there's so much transmission that 20-something super athletes for a Major League Baseball team are all getting infected, just going about day-to-day business. We shouldn't be even thinking about reopening if you see 5% of random tests coming back positive every single day in community screening. If we are going to reopen a school and there's a lower rate of community transmission, then there has to be a smart way of doing it. And that's more than just using a lot of Lysol and elbow grease to clean the hallways. It involves doing baseline testing of specific volunteer cohorts that represent different age kids, teachers, the staff, the cafeteria workers, the janitorial staff, and determine what's your baseline infection rates, and then keep track of those cohorts over time. And if anything changes, have policies in place to jump in, do contact tracing of everybody that they've been in contact with, the students, the faculty, and so on, and isolate anybody who's infected for 2 weeks. This is the kind of basics that have been in place in countries that have done this right. But I don't know of any community anywhere in the United States that's ready to do this right.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.